This topic is nephrolithiasis, which refers to kidney stones or renal calculi. Nephrolithiasis refers to the process of stone or calculi formation within the urinary tract. Stone formation is often preceded by a change in the composition of the urine. When the urine changes in composition, salts within the urine can crystallize and form solid deposits. Now, as these crystals and solid deposits aggregate together, this is what leads to the formation of kidney stones. Let's take a look at the image here on the right. One thing about kidney stones is that they are primarily going to form within the kidney. Now, as they form within the kidney and travel through the genitourinary system, they can become lodged within a number of different locations, which can lead to the development of clinical features that are focused specifically on that region. There are a number of different types of stones that can be formed within the kidney, and their formation depends on a variety of conditions. Calcium stones are the most common, and they form from salts such as calcium oxalate or calcium phosphate. Uric acid stones form from an increase in the excretion of uric acid, which is going to be more common in individuals with gout. And the development of struvite stones are associated with infection and can become very large in size. Risk factors for nephrolithiasis are going to be associated with an increase in the concentration of solutes within the urine. Remember, the most common type of kidney stone that's formed is a calcium stone. So any condition that leads to the development of hypercalcemia can lead to an increase in the risk of development of those stones. So if the client has had too much calcium intake, if they intake too much vitamin D, which leads to an increase in intestinal absorption of calcium, and in conditions like hyperparathyroidism. Remember, parathyroid hormone is important when it comes to increasing absorption of calcium from the intestine itself, but also contributes to an increase in the release of calcium from the bones themselves. Conditions like dehydration can increase kidney stone formation. If we concentrate the urine, this will bring certain solid and particulate matter together and will make it more likely for them to precipitate out of the urine. A family history of kidney stones increases the client's risk of developing them. Immobilization can lead to urinary stasis and urinary retention, which again will increase the likelihood of solutes precipitating out of the urine. If a client has gout, this can lead to a high serum uric acid, which leads to more uric acid excretion by the kidneys and development of those uric acid stones. And chronic urine stasis or infections leads to the development of those struvite stones. If a kidney stone is small enough, the client may be able to pass it without even noticing that they had the stone, or it may only cause some mild discomfort. However, if a stone is large enough, this can lead to obstruction of a ureter, which can cause some of the more significant clinical features. One of the most common findings that we're going to see in a client with acute nephrolithiasis is severe flank pain that radiates to the groin. So if we look at this image here, we can see where that pain is going to be associated. If the stone is situated up higher, we may have more kidney pain or flank pain. And as the stone descends along that ureter, that's when we're going to have pain shift towards the lower abdomen and groin. Renal colic is a term that's associated with this type of pain. When the stone is in that ureter, it can lead to spasms and muscle cramping, which can be very uncomfortable for the client. A recognizable feature of this renal colic is what we would refer to as a kidney stone dance. Essentially, clients are not able to get comfortable enough, and they move from a standing position to a seated position to a lying position, maybe back to a standing position. We see them change position frequently because they're not able to get comfortable. This type of intense pain can lead to the development of nausea and vomiting. And if the kidney stone is sharp or causes significant irritation of the urinary tract, the client may develop hematuria. When we have obstruction of urine, this can lead to dysuria and urinary urgency. Sometimes we see similar symptoms like with a UTI, especially since a kidney stone can lead to the development of a urinary tract infection. Diagnosis of nephrolithiasis is done with a CT scan or an ultrasound, which is typically used for our pregnant clients or children. And once a stone or stone fragments have been passed, we can analyze these in the lab to help determine the cause of the formation of that kidney stone, whether that's from that increase in calcium salts within the urine, from an increase in uric acid, or from a urinary tract infection leading to struvite stones. Remember, if a stone is small enough, the client may not even notice passing the stone or may only have some mild discomfort. However, large stones lead to obstruction, which can cause a number of complications. When a stone obstructs the urinary tract, this leads to a buildup and backflow of urine into the kidneys themselves. It's important to note that the manifestations of kidney stones usually happen unilaterally, meaning that it's only going to affect one kidney at a time. When a stone obstructs the urinary tract, this leads to a backflow and buildup of urine proximal to that obstruction. As the urine backs up, this will begin to fill the renal calyces, essentially leading to hydronephrosis. That increase in pressure within the kidneys leads to compression of the renal tissue, which can affect the glomeruli as well as the nephrons, and eventually lead to renal impairment, and possibly acute kidney injury. And because urine cannot get past that obstruction, urinary stasis occurs, which increases the risk for infection. When a client presents with acute nephrolithiasis, nursing interventions are going to focus heavily on pain management. And we want to use a combination of non-pharmacologic as well as pharmacologic interventions, such as the use of a heating pad as well as analgesics. IV fluid resuscitation is important with these clients. Again, if we have urine that's concentrated, that's going to increase the likelihood of the development of kidney stones. So when we hydrate the client, that's going to help dilute the urine and prevent any further kidney stone formation. The client may need antiemetics if they have severe nausea and vomiting. And it's important for us to strain all urine, not only to monitor for the presence of the kidney stone itself or stone fragments, but also to be able to take those stones and analyze them like we discussed earlier. We want to make sure that we get the client up and ambulating, which will help improve blood flow to the kidneys, as well as employ gravity to help bring that stone out from the urinary tract itself. Now, if the stone is quite large, the client may need to be prepared for a lithotripsy, which essentially is the use of shock waves or ultrasound therapy to help break up the stone itself. When we break up that stone into smaller fragments, this will help it better pass through the urinary tract. Additionally, we need to monitor for any complications of acute nephrolithiasis, such as the development of pyelonephritis. Again, with that urinary stasis and buildup of urine in the kidneys, this increases the risk for the development of infection. So we need to monitor for fever and tachycardia, as well as any other symptoms of infection, such as monitoring the client's intake and output, as well as monitoring some of their kidney function tests, such as their BUN and creatinine levels. Let's take a little closer look at lithotripsy. So there are a number of different types of ways that lithotripsy can occur. What we're showing here on this slide is the use of extracorporeal shock wave lithotripsy, which is a fancy way of saying that we use shock waves to help break up a large kidney stone. Before this procedure, the client needs to remain NPO and should discuss this procedure with the healthcare provider and sign an informed consent. Following a lithotripsy, it's common for the client to have some dull flank pain through the use of those shock waves. The urine may be slightly blood-tinged in color, which is an expected finding as long as it's not gross hematuria. We may see sand-like fragments. Now, this is the broken up pieces of that stone that have become very fine, and we see that being passed through the urine. And we may notice some mild bruising to the flank area. Once we resolved acute nephrolithiasis and its associated symptoms, client teaching focuses on preventing recurrence of kidney stones. So we need to encourage the client to consume about 2 to 3 liters of fluid per day, which will help to dilute the urine and prevent stone formation. We should encourage regular exercise, which will help promote healthy kidneys through increased blood flow, as well as prevent urinary stasis from occurring. We want to prevent the formation of calcium stones. So one way to prevent the development of these stones is to limit high oxalate foods, which include foods like spinach, tofu, and potatoes. So we want to encourage the client to reduce their sodium intake. This will lead to reduced excretion of calcium by the kidneys. Likewise, we want to encourage the client to form a normal calcium diet, not a low calcium diet. Calcium and oxalate bind together in the gastrointestinal tract. So if we decrease the amount of dietary calcium, this will increase the amount of oxalate that we absorb from our diet. When we do this, this leads to the formation of calcium oxalate, and therefore the client should maintain normal calcium intake. If a client had uric acid stones, we want to limit the amount of protein intake that they have. Proteins have a lot of purines, which leads to the formation of uric acid. And to prevent the formation of struvite stones, we should encourage strategies that help prevent urinary tract infection.